Hello and welcome to Stress Response in Disaster Workers. I'm Jenkins. I'm Associate Professor of Emergency Medicine at the Johns Hopkins University School of Medicine. I've been the disaster control physician for the Johns Hopkins Hospital, and I've been a member of a disaster medical assistance team here in the United States for over 10 years. I currently sit on the board of the World Association for Disaster and Emergency Medicine, WADM. The content of my presentation does not violate any proprietary rights, and I comply with HIPAA. All right, let's talk about sources of stress. These can be environmental, social, personal. For the purposes of this presentation, we're going to concentrate mainly on what's happening right now all around the globe. We're going to concentrate on COVID and the stress response that healthcare workers and disaster workers are having in response to that. We all know that disaster workers are experiencing exposure to grief, longer hours, poor sleep, and not just grief within their patients, but grief within their coworkers. And then also they might be experiencing loss within my own family or within their own family. My family has had loss as a result of COVID. So I know we're all experiencing this. All right. So we have both acute and chronic stress, and this really builds on top of one another, right? And when acute and chronic stress builds on top of one another and you have chronic stress for a long period of time, then this might lead to something we call burnout. All right. You can see this Twitter post. This is one healthcare provider who's posted what it looks like to wear an N95 PPE for many, many hours at a time. And it truly can be exhausting day after day, month after month. One study found that US healthcare professionals, over half, are very concerned about their own safety, and 65% report receiving no additional mental health resources, and about a quarter expects their compensation to be even lower as the result of COVID. All right, so what is resilience? A lot of people talk about in response to burnout, they talk about building resilience. Well, some organizations and people have defined it as the ability to cope with stress and adversity without suffering lasting physical or psychological harm. And it's also really an active process of becoming aware of and learning to make healthy choices, keeping yourself in good condition mentally, physically, and socially, even though everything else around you is extraordinarily stressful. Okay. And we're going to talk about that this is important for individuals to do, but it's also really important for organizations to do. And no one can really do this all on their own, right? We all need a little bit of help. Okay, insomnia from high stress. More than a third of medical staff have suffered insomnia during the COVID-19 epidemic in China. This is one study. They said under these dangerous conditions, medical staff become mentally and physically exhausted and therefore experience an increased risk of insomnia due to high stress. We're going to talk about some of the physiological mechanisms for this and some of the hormones and physiological compounds that become upramped during stress. Right? But in addition to impaired sleep during longer responses, we know that stress is also impaired even during shorter responses. In a study we did after the 9/11 attacks, we had search and rescue responders that responded to the Pentagon. They said their average amount of sleep was around 5.5 hours. And even without any intervention or suggestion, about 40% of them had already attempted to use sleep aids, such as earplugs, mental imagery, listening to music, using blindfolds. and only a very small percent, about 15, would consider using pharmacologic methods. And this kind of makes sense whenever you are in a whenever you're in a response to a short-term disaster, and you may be sleeping very near the scene of your response. You're kind of always on 24 hours a day, and you wouldn't want to take something pharmacologically to help you sleep. All right. So, what are some of the physiological reasons that um, we have this insomnia or we have these worsening medical conditions? This shows diabetes at the end result of all this stress. But you can imagine how many of these hormones upramped can affect not, can result not just in diabetes, but potentially things like coronary artery disease or insomnia. So when we have stress, the effects on the body, one thing that it does is it upramps our HPA axis. And when this happens, cortisol is increased. And this can even cause a subclinical increase in cortisol, that meaning subclinical, meaning that when you just look at a person, you may not be able to realize it. But some markers that you might be able to measure, there might be an increase in waist circumference due to increased cortisol. You might see an increase in lab values like the hemoglobin A1C, increase in triglycerides, or a decrease in the HDL, and that's the good cholesterol. These things can all increase insulin resistance. What else can we get? Unfortunately, the autonomic nervous system gets activated with both acute stress and chronic stress over time. This causes the norepi and the epi to be increased in the body at inappropriate times. These are times when we don't necessarily need to be in that fight or fight mode, but we are regardless. And also, when we're stressed, the body increases its secretion of things like IL-6, and the CRP levels in the body go up. This leads to both insulin resistance and an increase in endothelial dysfunction as well. All right, this is just another graphic about stress hormones and some of the things that they can cause whenever we are either acutely or chronically stressed. Our breathing increases, our heart rate increases, right? Our pupils dilate, our blood pressure increases. And remember, we talked about the epinephrine and the norepi and the effects on insulin. Well, over time, the blood sugar levels increase also. And this might be what you want if you are fighting off an attacker or if you're in fight or flight mode. But this is not what we want when we're dealing with stress over a long period of time, right? These really have detrimental effects on the body. So, how are some other ways that we can measure it? We know we can look at some of these lab values, right? We can also measure the heart rate. We can look at heart rate variations by some of these wearable devices that we have. We can look at blood pressure over time to see if blood pressure is rising as a result of chronic stress. And then there also are several peer-reviewed surveys and questionnaires that healthcare providers can fill out and then track their, chronic stress levels over time. All right. So we know the stress is bad for us. We've seen the physiological effects, but what can we do about it personally? And then we'll also, talk about how can we advocate at an institutional structural level uh, for this as well. One thing we can do is called cognitive behavioral therapy for insomnia. And this is things like improving sleep hygiene, meaning that don't use your phone or your computer before bedtime, and do things like relaxation therapy. This may be just doing breathing exercises, something really simple like that. And then The National Institute of Health has a graphic that they've put out that has some suggestions. One thing that's really nice on here is take a break from the news. And we all want to know what's going on in the world, but sometimes if you're really immersed within um, healthcare and taking care of COVID patients and just really being immersed in the disaster all the time, and then you go home and then you just keep looking at the news about the disaster, then that just continues your stress even at home, when we should be relaxing or taking those breaks. So, if you can, if you must listen to the news, listen to it during a certain part of the day, and then just try to put it aside and really, really take a break from it. Try to take care of your body. And, in times of stress, oftentimes we don't eat well. We eat comfort foods, things that, and sugars, things that feel good for us. But do try to eat nutritious foods, fruits and vegetables and lean proteins, things that can really help you to take care of yourself and connect with other people, to talk to other people. Um, this can be challenging in times of social distancing, but don't be afraid to send that text or to pick up the phone and just say, "Hey, how you doing?" Or if it's, one of your fellow healthcare workers, you know, just say, "Hey, how are you doing? What are you up to today?" Don't be afraid. Don't be afraid to do that. These are some other examples of some physical practice and wellness courses that might be out there. When we talk about physical practice, that's really the connection that moving the body, getting some exercise can help to ameliorate um, these poor effects of this increased adrenaline and norepi that our body feels. Actually, getting exercise and moving our body can help decrease that in increased sugar that we have as a result of stress, and decrease these stress hormones, um, and I think improve over time. And a regular regimen like this has been shown um, by multiple studies to help decrease the effects of stress. This is one course also specifically for healthcare workers, produced um, and by the Health and Human Services. And this is the website ASPR Tracy TRACIE.hhs.gov, that you can go to and take a short course on stress in healthcare workers. All right. One thing that's also mentioned on here is personal journaling. Many of us perhaps have never journaled or haven't journaled since we were young, but this is a very nice way of just processing emotion and processing stress. And the um, the routine or the process of having a thought in your brain and putting it on pen to paper, or putting it, whatever your journaling mechanism is saying, there's my stressful thought. I'm putting it external to myself. And this can be a nice mechanism to process stress during these times. But is it really up to the individual to be resilient? And so I think here we're going to say, no, it's not up to the individual just to be resilient. If you're within a work environment that doesn't have proper personal protective equipment, or that has or is completely overwhelmed with patients, or whatever the case may be, it's obvious that many of these causes are, out of the control of the healthcare worker. And so it really takes an institutional structural system and changes, not just to resilience efforts, things like, oh, take this wellness course, you'll be fine, but things that actually improve the working environment of healthcare workers and disaster workers, right? Make sure that healthcare workers feel like they are protected and respected within their working space. Not just that they feel protected, but that they have what they need to do their jobs, right? We know that stress management and mitigation of the effects on the body and psyche are both the responsibility of the healthcare worker and the institution. If the nurses and the doctors and the techs and the housekeepers, if all of those people don't feel protected, able to do their job, then that hurts both them, it hurts patients, and it hurts the institution. Right. Thank you so much for joining me on this presentation of stress in disaster workers. And I hope that you enjoy the rest of the conference.